focus. Okay, that's fine. Okay, sorry. Actually, this morning I presented a seminar, and then now the seminar is still ongoing. So I'm using both Zoom and Webex at the same time. In my ear now, the seminar is going on, and then they will call me after this to take picture with the presenter. So I will turn off my camera for a while to go to the Zoom. So it's like I'm using both monitor now. Okay, my next monitor is the seminar. Okay. If I have another one, I use my TV in my office. It's all connected to my computer, so 3 monitor. Okay. Let me see. For today, we are going. What's the topic for today? Sorry, I'm teaching so many classes, so many DVM. I don't know what I'm supposed to teach today. I think some avian physical examination, right? Okay. Let me see what I'm supposed to do. Share screen, screen 1 or screen 2, screen 2. Okay, this is what I'm listening now. Okay, Dr. Azlan is presenting on the Zoom. So, okay. Did you hear the Zoom or not? I hope not. Only my
No,
voice,
we
right?
don't.
No, okay. Because I didn't. Okay, or else it's gonna interrupt. I need to be aware also if they scream my name in the earphone. Okay. For today, we are going to discuss on avian physical examination. Okay, I think you have done physical examination for other species, if I'm not mistaken. It's almost the same thing. It's just that for avian, it's slightly tricky in a way that we do have a lot of species and it's totally different from each other. And then it can be classified as pet birds or for poultry. So when it comes to avian, if you want to do physical for pet birds, it's almost similar with small animal. But when it comes to poultry, you do is similar to farm animals. So the approach is kinda different lah. Okay. For avian world, we have a diversity of avian species. Okay, unlike cats and dogs. Okay, they are one species but different breeds. So it's just different. But for avian, there's like different species altogether. Each individual birds, okay, are different species, different morphology. They can either be in wildlife, some are kept as companion animals, and then many are kept as livestock or poultry, meats and eggs productions. An avian species varies from few grams, like hummingbirds, to as big as more than 100 kilograms, such as emus, cassowary, ostriches, all those things. Okay. And then before we proceed further, to understand, to have the best, to maximize your physical examination, okay, you need to have all the basics about the anatomy and physiology of all these birds. Okay, if you are expecting some birds, okay, if you are expecting some birds to attend your clinic, it's best if they already tell you over the phone, they will make appointment. Okay, the bird I'm giving today is African grey, for example. Or the birds I'm sending you today is cockatoo. Or the bird I'm sending today is just a crow. Or an owl. Or flamingo or something. You see? So it's best for you to revise the anatomy and physiology of all these animals beforehand, before they even attend the physical examination, before you consult them. Because even for me, of course, for me, I'm more on the poultry side. Prof. Jalila is more on the avian side, animal side, wildlife, and pet animals. So she's more familiar. For me, if I have to attend all these birds cases, I really have to read beforehand because the physiology is different from each other. Their feet is different. Their behavior is different. Okay, so it's a lot more complicated. Unlike cat and dogs, it's almost all the same. Different cats breeds, the behavior, the anatomy is almost the same. Cat, dog, and the dogs also almost the same. But for birds, it's slightly different. Okay. So this is the basic anatomy for almost birds lah, all the birds. So you just have to get familiar with this. I think you have learned this in your anatomy class. Okay, in your anatomy class, different parts. Okay, birds have usually the 10 primary feathers. This is important, particularly in wildlife. Okay, because they need to fly or else they become prey. Okay, if they come with broken feathers. Okay, if we remove the primary feathers, even some are broken, they will impair their flying abilities. Okay, and then you have to understand all the bones of the birds also. Or like unlike mammals, they are slightly different. There's a lot of like things unique to the to the birds, such as that they have like more hollow bones. Okay, the anatomy is slightly different. They have like fused, okay, uh, vertebral bone up there. Okay, you call it synsacrum. Okay, so you just have to get familiar with the anatomy before. I'm not going to go in detail on these things. Okay, I think this one you can just revise back on your anatomy notes. Okay, and then this is the chickens. Okay, you have seen chickens before. This is the basic anatomy of chickens, the back, the keel, the thigh. Okay, the shank, the toes, the feathers, the wattle, the comb. Okay, these are the basics. So different parts of the body can show you or can give signs of different diseases. Different discoloration of certain part of the bodies can pointing towards certain diseases. Okay, different enlargement of certain parts can also point to certain diseases. So you just get familiar. You need to know the normal anatomy before you even to so that you can make a proper judgment whether this is what do you call it abnormal or not. Okay, if you don't even know the normal anatomy, it's gonna be difficult for you if you do physical examinations. Okay, it happens with all your seniors also when they go to farms with me. When we do postmortems, some of them didn't even know different organs. Is this spleen? What is this, doctor? Is this liver? Is this heart or something? Then if you don't even know all these basic things, it's very difficult for you to even appreciate whether it's normal or not. You don't even know the normal the anatomy of the animal, so it's gonna be difficult. So get familiar with the basic anatomy. And then, like I said, bird anatomies they differ based on species, based on the behavior and the feet. Okay, even the beaks and the feet. You can see from here. Okay, the feet of of the birds are different based on their behavior and their habitat. The swimming one usually they have webs like ducks. Okay, some even have the smaller type of webs. Okay, they both swim and walking. Some are walking. It's like chickens. Okay, they have like this perchings, slightly different digits, much longer. Okay, and then the claw much more sharper. This one is for raptors. Okay, this is a weapon. Okay, for seizing prey, they grab rabbits, they grab a lot of animals by using though they have a very strong legs for prey, for woodpeckers. Even the big morphology also differ based on their habitat, based on their food, okay, and then behavior. So we have the filtering, like ducks, they filter. You can see the scoop foods, and the probing animals. Okay, this one is like for like hummingbirds, they suck out honeys and all those things. So it's very long. Catching insects, those are insect eaters. Some seed eaters, so they have slightly different. And raptors, they need a much sharper one to tear off all the meats. And this one is the woodpecker's head. Okay. So it's different from each other. So this will give you clues on what the animal eats also sometimes. Is if sometimes for me personally, I don't remember all the bird species. Okay, I have to ask. Sometimes I have to refer books. Okay, because I don't know. Prof. Jaila have a wider knowledge on this. Okay, she probably know how to detect the birds when they are flying. For me, it's just birds on the sky. Okay, I don't even know what birds is that. Okay, I know it's chickens lah, but for birds I don't know. Okay, topography of the head and beaks. Okay, again, this is the same thing. Okay, you can read further. Okay, we have a lot of like animal, different beaks. I'm not gonna go in details because there's too many. Like pelicans have different way. Okay, flamingo have different kind of beaks. Even hornbills have difference. Candy flamingo have like going down like that. Okay, it's all this. You don't have to memorize this. I don't expect you to memorize this, but at least know the normal. There are different types lah. Some are for filtering, some for probing, cracking, seeds and whatnot. All those things. Okay, this again. And that's chicken. Chicken, of course, you know lah. Okay, this hawk raptors. Ini burung apa? It's like heron for me. Okay. And then we have owls, raptors also, different type of owls and different African bald eagle. They are, what do you call it? They are national bird, national animal. African bald eagle is on their logo. Okay. And then this is in Malaysia. We have our hornbills. We have pelicans, flamingo. Okay. This is what bird is this? This is actually a pigeon. We do have this. If you go to Sunway Lagoons, they also have all the animals there. You can see this one. This is the biggest pigeon in the world. They're like as big as like this one. Like I don't know how many kilos. They cannot fly. They just walk like chickens, but they category as pigeons. Okay, and topography of the feet. Okay, it depends on the foods, what their habitat and behavior. They're walking on the muds like heron, grasping or hold the prey like eagles, paddling along the waters like ducks. We have hopping like pigeons, woodpeckers. They have need to climb upstairs. They have 2 up and 2 down. Okay, perchings like sparrows. Okay, this is some of the topography of the feet. And then even like emus have differently. Emus has like 2 claws, 2 digits in the front. Just one and it's like a long one because they have to sustain their heavy body weight and they can run really fast. Okay, raptors. Okay, this is the I think I've taught you before in your DVM1. Okay, different. This is their weapons for raptors. Okay, you have to be very careful with the claws. It's very sharp. Okay, it's called talons to capture, kill, and carry prey with their feet. So you have to be quite careful with handling raptors. If they grab your hand, it's gonna be quite a problem because you need 2 people to open it. Okay, if they grab your hand like that, and then if you want to open, pull out one of the digits, and then the one at the back goes inside. So you need one person to like holding open all them together. Okay, if you do alone, it's gonna be difficult. If you do alone, it's gonna be. I had that before. You go deep inside and it's bleeding like crazy. Okay, so you have to be careful in handling raptors. That's why if you want to handle raptors, it's best if you use a leather glove. Okay, be careful when handling raptors. Use leather glove. Okay, so that it don't pierce your meat, your flesh. Okay, this is how they look like. Some of the raptors look like the smaller ones. Okay, and we have water birds. This one you don't have to worry so much. Okay, okay. Water bird like ducks have webbing between their toes for swimming. Gulls also have feet similar to this, so they don't sink while walking on the soft sand or muds near the water edges. They have the web so that they can swim properly. And pigeons and chickens, okay, use their strong feet to scratch the dirt and leave litters to uncover feeds and insects. Okay, this is all their digits. You count the digits from here. Okay, 1, 2, 3, 4. Okay, this is number 1. This is how they. Okay, even peacock is also under the same thing. Songbirds or perching birds, okay, warblers, thrushes, wrens, etc., have independent, flexible toes. The back one, with one pointing backwards, ideal for grasping perches. And then why don't perching birds fall out of trees when they sleep? Because when they sit down, they have a locking mechanism. Okay, the backside of the ankle automatically flexes, locking their toes around the branches. With feet locks, sleeping birds don't fall. Okay, if once they sit down, it's like a lock there. Even the tree shakes and whatnot, they're still there. Okay, unless they can only unlock when they stand. It's like the locking mechanism. Okay, that's why they can sleep on the tree without falling off. Okay, and then strong-legged flightless birds like ostriches, cassowary protect themselves by kicking their powerful feet and sharp claws. Okay, you can even ride the ostriches. Okay, they are is the leg is very strong. Okay, and they're very fast as well. Woodpeckers slightly different. They have 2 digits in the front, 2 digit at the back because they need to climb upwards. And then they are not standing on the perch. They stand horizontally, no vertically. Okay, they have 2 toes pointing forward and 2 backwards for climbing up, down, and sideways of tree trunks. So they are like in a chest is they're like queen. They can move everywhere. Okay. Wedding birds, long toes of herons, which spreads to the bird waist over a large surface areas. Facilitates walking on soft surfaces near water edges where wading birds like to eat. So they have much longer digits, okay, to so that they don't if they have a shorter digits, they sort of tenggelam, okay, faster, okay. So if you have a longer digit, it can sustain their body weight over soft surfaces like sands, all those things, because they're looking for foods around this area. Okay, so that's the uniqueness of birds. Each individual birds are unique. Okay, if you want to examine different birds, you have to totally understand what is wrong. You don't simply, oh, this leg is wrong. It looks bended. It might be a normal anatomy. Okay, this leg is too long. Maybe it's born cacat or anything. No, maybe that's not only. You have to know the normal anatomy of the birds. Okay, if you don't know the normal anatomy of certain species, you might feel like, oh, this is different. Doesn't look like chicken. Why is the comb black? Why is this color red or something? Okay, maybe that's the normal color. Okay, it's not, you don't simply assume, oh, it's congested everywhere. Okay, maybe it's just the normal color. It's the skin is red in nature. Or it's like, for example, ayam selasih. You know ayam selasih, where the chicken is like totally black. Even the meat is black. The everything is like literally black. Okay, so that's normal for that particular species. Okay, it's not like because they are cyanotic or anything. It's normal to that particular species. Okay, so to handle birds, when it comes to handling birds for physical examination, you may need to have some equipments. Okay, because different species, like I said just now, they have different weapons to attack you. So you need hoods, safety glasses, glove, masking tapes, net or towels or paper. Okay, this is all the things that you need. You need hood sometime to cover the head. Okay, you not to cover your head, to cover the bird's head. Okay, and then the safety glasses in case on some birds, because they can pack your eyes. Okay, they can pack your eyes. Okay, glove like leather glove if you are handling raptors. Masking tape, usually you use this if you are alone. Okay, if you're alone, you probably need masking tape. What we did is, okay, we tape all the wing, both the wings together. Use masking tape. Tape on the wing, because if you want to do physical examination, you need someone to restrain the animal, and then while doing physical examination. If you're alone or you have limited staff, and then the move too much, you use the masking tape, tape their wing. Okay, tape their wing to the body so they cannot move. Okay, it's like towels lah. Okay, the easiest is just you can also use towels and nets. Sometimes we have a lot of cases in our hospital here. The birds fly, okay, while we are doing physical examination, and then the rest of like 1 hour is just trying to catch the birds. Okay, we even have like owners bringing the birds without cages. Okay, and then they thought their birds is like very nice or something, and then it's sort of like it flew, okay, and then they stand on the aircon, okay, so the all the stuff like catching birds here and there. Okay, so you have to be careful with all these things. Okay. For methods of restraining, I've taught you before. We do have quite few common methods of restraining. Depends on the behavior, depends on the type of birds. We use leg grabs mainly for raptors because we want to grab the leg first before they grab you. Okay, like I told you, the claws the talons is very sharp. Body grab you use for most of the animals, most of the birds. One hand hold is basically for small animals. Okay, and citizen technique for citizen, all the parrots and whatnot. Okay, we do have different other restraining technique, but you adjust accordingly. Depends on the morphology of the birds. Okay, so you adjust accordingly lah. You don't simply use leg grab all the time for raptors. No, if the birds are really nice, okay, just use body grab. If the citizen technique, also you don't actually use citizen technique whenever you handle raptors or parrots. Okay, if they are really nice, listen to the owners. You don't even all use all this technique. Ask the owner to restrain it. Put on their hand, okay, and then talk to the birds. Hi, can I see your birds? Okay, hi, how are you or something, and then open their wings and whatnot. Some of the birds that are very nice. Okay, they allow you to touch them. Okay, you can play with the birds and whatnot. Okay. So this is the sit-and-sin technique. Sit-and-sin technique focus mainly in holding the head. Okay. So you want to hold the head. Oh, I'm sorry. My arrow is, I thought I'm using it. Okay, holding the heads. Because the beak, okay, the beak is like really strong. They can open all the hard shell nuts with easy. Okay, and then like cutting off your finger is like nothing. Okay, I've handled like a small budgie before. We have to catch an aviary. It's like very small. The bird is like really, really small. So I okay lah, I don't need towel lah. And then it bite me. And like in between my toes and my thumbs and my index finger. Like all this small skin there. It's so painful. To the point that I want to dislocate the head. I was like, come on. It's so painful. And all the students was just laughing. It's like, come on, you need to remove this bird. It's like whenever the student want to remove the bird, the bird keep pulling my skin. Okay, it like already pierced my some of my edges of the skin. It's like this bird. I feel like to the point even though the small one, like only this big, it's like so painful. You feel like you want to smack them on the floor already. Because it's so painful. Imagine all the big ones. Okay, it's literally painful. Okay, so you have to be careful, even though they look docile. Okay, so this is how do we look like. We catch them with nets, and then after you catch them with nets, you immediately grab the head. Grab the head. Don't choke them, just grab the head. Ni tangan Prof Jalila ni, saya kenal dia punya gelang dengan. Okay, and then also this is Prof Jalila, I think. Okay, this is a body grab. Usually you use for pigeons and dove. Most of the birds you use body grab. Okay, even chickens you use body grabs. And then leg grab, mainly for raptors. Okay, I think I've shown you this before. You use raptors. You use glove as well. And one hand hold for much smaller birds. Okay, one smaller birds. Okay, raptor one. Okay, you focus, always grab the leg. Use leather glove if possible. Grab the legs. Again, okay, we use leather glove to grab the legs. We use safety glasses sometimes. Okay. Pigeon restraint, this is quite unique lah, but you don't usually for pigeon we just use body grab. This is sufficient for pigeon. We use cradle hold. So like I said, different species you have to adjust accordingly. We have so many species, different sizes. Look at this one. I need another 2%. It's a flamingo. The leg is like very long, paddling here and there. The neck also very long. If you use body grab, it's not enough. They keep kicking me with this leg and then keep pecking me with so you need 2% to handle it. Okay, this one, if I'm not mistaken, it was somewhere in Payajaras. I tried to take bloods from these birds. Okay, and then if the bird is nice, you can just handle it nicely. Okay, you don't have to do excessive, unnecessary stress to the birds. Okay, birds can actually die. Okay, due to stress. They are really prone to heart attack also. Okay, we have a lot of cases. While handling the birds, while doing physical examination in front of the owner, the bird dropped dead. Okay, that happens. Sometimes they just stress when they see new people, too many people in the room, and small birds, they just fly here and there in the cage, back, drop that. Okay, and then we are looking at the owner. It's like, oh shit, we need to explain something to the owner. Okay, so be very careful. So if possible, just be calm and quiet. Okay, turn off the light if possible. Let the bird come. If you see the bird is too panicking, okay, just cover the cage with towels for a while. Let it be in darker rooms. Usually they're a bit calmer. So you just turn off the light. Let the bird calm down, and then restrain them slowly. Or you can just chase away unnecessary stuff in the rooms. Okay, because they just get panic. Okay, and then for ostriches, this is how you will do it. We need you to use crutches. It's like ruminants also, bring in crutches, and then remove the head cover. Put socks on the head just to calm them down, and then do physical examination. I have a question, if I'm not mistaken. I'll answer your question later, yeah. All of this because I'm using two screens. They're projecting on different screens. Okay, now after. So those are the basics forest trainings. I think you have taught you before in DVM1. Most likely you have forgotten it. So I will teach you again during the practical class. I do have practical class with you, I think. I don't know when. Been very busy. I don't know. Sometime soon, I think. Class rep, please remind me. Okay, it's okay for that one. Okay, so again, for when it comes to basic physical examination, it's almost similar with cats and dogs. The steps is similar. Okay, the step is similar. You need to take history. You need to examine the animals from far first before touching them, and then restrain the animals, examine, do physical examination, and take samples. Okay, so these are the basic information that this is the usually the flow lah, the basic flow of doing physical examination for birds is very similar to small animals. Okay, if they make a call for you to make appointments, so it really depends on what is their complaints. So you need to have some informations or with from the owners through the phone calls. It's just through phone calls. Okay, if possible, bring the cage along. Okay, you bring the cage along with fecal collections. Don't remove the fecal just to look nice because you want to bring to the vets. You remove all the feces. Bring everything, even with the feces, everything, because sometimes all these feces can give you some general idea. The color of the feces, the consistency, if it's watery, if it's dark, is blood in the feces, all these things. Just tell the owner, just bring everything. You don't have to clean your cages first. Okay, change cages, just bring along with the cage. Okay, food and water, usually we have to remove it. Okay, you remove it. If they want to bring some of the foods, also can, just example, some samples. Bring along toys and purchases. If they have, just leave it in the cage. It's also okay. Just leave it the toys and purchases, because these kind of things can give you some general ideas on certain diseases or certain mismanagement issue. If the toys is too small, is they give like wooden toys, something that they can bite and swallow. Okay, it can give you, if the bird is showing sign of choking, you know probably it's the toys is the issue. If the animal have purchased in the cage, okay, there's something you observe, because sometimes some animals, some pet birds, if they don't have toys, they don't have purchase, that leads to some behavioral issue. They tend to get bored. Okay, when they get bored, one of the thing they do is they remove their feathers. Okay, they remove their feathers. So sometimes you see that all the bald animals, sometimes it's because they are bored. Okay, they don't have nothing to pet and play with, so they start packing off their feathers. There's some differential diagnosis. And then if they have given medications, please bring along the medication, because some owners, they don't know what is the active ingredient of the medication. What they know is, doctor, I gave you a blue pill, a yellow like fluid or something I bought at pet shop. Okay, we need to know the ingredients, the active ingredients. Maybe the medication is also related with the toxicity. Okay, maybe medication is also overdose or something. You need to know what have they done before. Okay, history taking. Okay, after they come over, you met them, you do history taking. It's very similar to cats and dogs. Okay, with small animals or any other species, you do very thorough history taking. Ask them everything. Any exposure to infectious disease or toxin? Are they alone? What's the environment look like? Are they the only birds in the house? What's the feeding management? What's the diet? The reproductive status, previous illness. Okay, I need to turn off my camera for a while. Wait. Okay. Shit. Wait. Wait. How do I stop share? Hello, kejap. Because I'm tengah guna webex at the same time. Macam mana yang sharing ni? Dia setting. Okay. Thank you. Thank you. Okay, guys, can you still hear me?
Yes, doctor.
Sorry, I need to smile because actually they asked all of us to. Oh, you can also still you can see the shared screen, right? they, they asked me to smile because they need to take picture of the speaker with the certificate. Give me 5 minutes. I need to entertain them for a while. Okay, I'm back. Leave this one. Leave meeting. Okay, is my video on here? Okay. Sorry, multitasking. There's so many things going on. Okay. Uh, where am I just now? Wait, now people call me. Hello? I'm in the middle of class now. Is it urgent? One hour. I finish like one. I'll talk to you later. Tengah kelas ni. Okay, okay. Okay. History taking. Okay, the history taking for birds is also basically the same thing. I know. You will have one class on history taking. You should practice yourself on history taking. It's very important. Communication skill is very important. Okay, show your professionalism. Ask thoroughly about any issue related to the animals, environment, the management, the diet, the productive status, and any previous illness. It will give you a lot of ideas. Okay, the history can give you a lot of ideas on the disease. Okay, a very thorough history taking you will have a very good diagnosis. And then after that, you evaluate the animals while they are still in the cage. Okay, don't see the behavior of the animals, let them calm down, look at the animals, how's the breeding look like, are they showing any signs or not, and then you also evaluate the cages. Is the cages size too small, too big? The construction, are they made of metals, are they made of woods, are they painted? Okay, because we also have cases, for example, lead toxicity. The birds like scrape off the paint and eat the paint, so it can lead to some toxicity as well. Okay, and then the content of the cage, whether it's plastic, and then you also evaluate the general attitude, whether they're eating properly, are they making sounds, are they preening? Okay, yeah, then preening. Preening is like grooming themselves. And then the respiratory effort and stance of the birds. Okay, the wing position. Okay, the normal healthy birds, usually the wing is located on the side. Okay, it's like totally on the side. If they are really weak, okay, or they have some wing issue, the wing drops. Okay, you can see the wing sort of like drop down. Okay, and then respiratory efforts, because the birds usually the bird respiration. I hope you know the physiology they're using. They use the air sacs. Okay, they use the air sacs. So you can observe them from the abdomen expansion and all those things. Okay, and then you look at them. Okay, while they are still in the cage. Okay, before you even remove them out. This is the budgie. Okay, this is how a budgie look like. Okay, any of you knows how to differentiate male and female budgie? Anybody owns a budgie? Nobody? Color.
Male
Colors
birds
here.
will sing
Yeah.
song.
This thing.
The budgie for male birds will sing when they are mature.
Wait, I need to change the sound to my earphone. Because now it's coming out from my speaker. I can't hear you. Okay, the cere here, okay, it's like a soft tissue on top of the beak here. Okay. The male one usually is blue in color, the female one is the white one. Okay. There's no color like that brownish. Not I'm not white, brownish. And then you look at the birds, most birds, okay, many birds, pet birds like cetacean, they are difficult to differentiate. The sort of like they don't have dimorphism, okay, they don't have the morphism or that can differentiate male and female. The only way you can differentiate male and female is based on PCR. Okay, you can take PCR, take feather, and then do PCR, and then you do genetic sexing. Okay, and in many birds lah, a lot of birds. But some birds, okay, some birds, you can differentiate them based on colors. Okay, the different color, referring to some animals, different color to me. But in bird world, it's very lucky to be males. Okay, it's very lucky to be males because the male one is the beautiful one. The pretty one is usually the male. The not pretty one is usually the female. Okay, like peacocks. Like male peacocks is the one that with the nice feathers. When you open it, look like fans, like colorful fans. And the female one just look like chicken. Okay, just like literally no all these fancy feathers. Okay, it's lucky to be males. It's a bird. Okay. Evaluation of the droppings. You also evaluate the urates and urine portion of the droppings. Uh, okay. Okay. The normal droppings usually in animals like chicken, like birds. Unlike mammals, okay, birds do not have like gallbladder. Okay, they don't have gallbladder. They secrete. They don't produce urine. Okay, they produce what do you call it? Uric acid. Okay, that's a white thing. The uric acid. Okay, it's a white thing. So usually a mixture of the normal color of like feces like this one lah. Okay, like a mixture of like solid one, and then a mix of like urates. Okay, the white one, and then some watery discharges. Okay, that's a normal one. And then you will see different color, especially if you see bloods and whatnot, it's totally abnormal. If it's too watery, also abnormal. If there is no solid, also it's quite abnormal. Okay, if it's also white, also it's quite abnormal. So, and also it depends on the food of the animals also. The different color is different, depends on the color of the foods also. If the some animals, some birds, if you feed them too much papaya, and then you will see the feces become like very orangey, okay, or carrots, they become very orangey, so it changes color based on their food as well. And the next one is physical examination. Doing physical examination, I'm not going to go very details on physical examination because we are going to have practical session. I will teach you during that one, but you can also refer to some of the notes. Okay, I uploaded in Putra Blast. That one is more in details. Okay, physical examination, you do you check everything up to from the toe to the feet, and from the head to the toes. Okay. You check the cages, the droppings, the attitude of the animals, the posture of the animals, the weight, whether it's normal weight, the body score of the birds, also the eyes, the color of the eyes, the whether they have like also discharges from the eyes, whether they have the conjunctivitis. You check all those things. You check the sinuses, the nostrils, any mucus, swollen of the face, swollen of the preorbital sinuses, the beak. Okay, is the beak in normal or is overgrown? Oropharynx, you have to open the mouth, the head, the skin colors, the feathers, the ears. Okay, we rarely check ears, but you may want to check ears in some birds. Like for example, owl. Owl has a very big ears. If you open, they're actually a very big ears for owl. We do have owl in the ward at the moment. Okay, if you flip their ears, okay, you can see their eyes, the eye bulb, eye globe inside the from the inside the ears. Is very the ear is like really big, like so big one. Okay, it's just all the feathers, you don't see it. And the eyes also, okay, the eyes are also quite big. It depends on the animals. This is example of like Marek's disease. Okay, this is the normal one. In Marek's disease, you'll see like the iris is become whitish in color. So some diseases you can see from the eyes. And you also observe the neck area. Check the neck, palpate the neck area, crop. Okay, if you want to know the bird is eating well or not, the crop should be full. Okay, have some food inside there. Okay, the consistency is like enlargement of the esophagus at the crop area. Okay, the neck area. And then you can also palpate the trachea if you want to. Okay, you can check the trachea. Okay, it's along the neck. Okay, and then the thorax, okay, thoracic cavity, the muscles, the skin and feathers. For chickens, for birds, we do score them, the physical scoring, physical examination, body score. We check by checking uh, the muscle surrounding the keel bone. Okay, the breast muscle, chicken breast muscle. You palpate the breast of the chicken, the breast muscle, and then the score is usually 1 to 3 or 1 to 5. It depends on, but usually we use a 1 to 3 score. Okay. For example, in broiler chickens, okay, it's like really big, it's rounded. That one is like score of 3. If it's like straight like that, it's score of 2. It's like very curved like that, it become 1 or 0. Okay. So you see the body scoring. If like the chicken is like really emaciated, they literally have no muscle on the keel bones. Okay. And then you can also check the skin and feathers. We have a lot of diseases involving skin and feathers. The abdomens, okay, the abdomens, the vent and cloaca, the wings, the feet and legs, the leg bands, if they have leg bands, the back. Okay, this is example of like bumblefoots on the back on the on the padding, okay, on the padding of the feet side, the bumblefoot area. So this all this thing. We will go more in details during the practical session. I'm not going to explain details here, but you can read the handout that I gave you through Putra Blast. Okay, this is my classmates. Okay, this is my classmate when we were students. Okay, they are handling birds. Okay, physical examination is a Macau. We also do all these things. Okay, see, you hold the neck like this. Okay, and then if you want to open the mouth of a parrot, don't open with your finger, okay, unless you want to use your finger. Use a speculum to open the mouth. We have a special instrument called speculum. But if you don't have this speculum in your clinic, I know some small animal clinic, they don't have this. You can use the back of a spoon or fork, okay, just to open the mouth. It's just that you cannot see through lah. You have to tengok from the side one because fork and spoon they don't have like hollow space in the middle to see. Okay, so this is what you look for in the mouth, and you look using the speculum. Don't use tongue depressor. Don't use tongue depressor or wooden stuff because they can break it and they can cause injury to them also. Use steel materials is better. Okay. And then this some of the thing like if you look into the mouth, if they have some whitish lesions in the oral cavity, it could be like foul pox, hypovitaminosis A, candidiasis, or trichomoniasis. Okay, for all of you, all these name of the disease may feel foreign to you, but don't worry, I will teach you in avian medicine next semester. You're taking avian medicine in the next semester, second semester of year 3. So don't worry. Okay, this is how we use it, the oral speculum. They have different sizes for different birds. And then you check the feather also, expand the wing. Okay, and they palpate if you see crepitus for fractures. Okay, and all these things. And then you check individual feathers. If the feathers are broken or not. You can fix the feathers if they're broken. Okay, we have and then palpate the abdominal cavity, the thoracic area, see for anything, and then check the feet. Okay, if you see any sign of early bumblefoots, you want to check the cages area if the surface of the cage is not clean and whatnot. Okay. Okay, this for example, this some injuries, not injuries lah. Some of the feather was plucked off. Okay, they probably have blood feathers. Blood feathers are new feathers. New feathers usually they have blood vessel inside it. If you break it, there's a blood will come out. The old one usually very dry one. There's no blood vessel inside it. Okay. So example, if you want to do eye examination, you can use special instruments for it. Okay. And then you can do mouth examination. For raptors, you can open the mouth easily with your hand. It's okay. Don't worry. You don't need to use speculum. Only for citizens. Okay, for pigeons, this is dove. Okay, this is dove. You can see here example of dove with pox, pigeon pox. Okay, very affecting the non-faded area. This cause crusty area. Okay, this one for example, mites infestation. This is mites. Okay, all these things. Nemdocoptes mutans. These also mites. You see all these whitish is also due to mites infestation actually. This one, if I'm not mistaken, it says the caseous material in the eye. Okay. What's wrong with the feather? Anybody can tell me what's wrong with the feather here? Any guess? It's just a feather. What's wrong with the feather? Have you seen a feather of birds before? Okay. Did you see all these blackish things? Okay, on the feather. Okay, all of these. Actually, those are lice eggs. Those are eggs. Okay, no, those are lice eggs. I've uh I've examined quite a number of like birds also before. I've examined those that are very badly managed. Also, I went to one aviary. They have a peacock totally in bad condition. The skin like they're full of mites and lice and ticks. They even have ticks. We rarely see ticks in birds, but this one you see ticks. Okay, the moment I touch the peacock, the moment I touch the peacock, you can feel a lot of things crawling on your hand. All the lice like transferred to your hand, to your body. Like they crawl. Suddenly all your hair like have like goosebumps. Okay, you have goosebumps on your hair because they are like crawling onto your body. That time I was like with students. Okay, and then I passed to another student the birds. So everybody offers like 10 of us like have lice. Okay. So for the rest of the day, me and Rota students like picking off lice from each other. Okay, you can see lice. You can see they are just like small ones. Okay, and there's some also bird that we went to one breeder farm. Okay, you can see the neck color. The bird is like white in color, except the neck area is like brownish in color. Okay. Some of students thought, oh, this is like the normal color of the feather. No, that's not normal. Those are like lice eggs. The reason they change color is because there's too much eggs. Until to the point it change color, become brownish. Okay, it's like really bad lah. Some. Okay, it's quite interesting to see all these birds. Okay, and then after you do physical examination, you done your physical examination. You have checked them thoroughly from up to down. You should have your differential diagnosis. Okay, on top of your head, you should have okay, this possible, this, and that, and then you proceed further with X-ray. If you think it's fracture, proceed with X-ray. If you think there's something in the stomach, the abdomen, or something, go for X-ray. If you think they get some infection or anything, okay, you can send samples for blood samples, swabs, and other things for CP, Bacti, Viro, and others. And then if needed, you need to do endoscopy, then you do endoscopy. And then it really depends on what you find during physical examinations. Okay, if you find you palpate them, I feel like something hard in the abdomen, you should have in on top of your head some differential diagnosis. For example, based on the age of this animal, based on the type of bird and whatnot, you should have differential diagnosis. Maybe your differential example diagnosis is egg binding, for example. Egg binding is like where birds lay eggs, but the eggs cannot come out from the body. So they have a lot of eggs, okay? A lot of eggs lining up inside the body cavity. So they stack up inside there. Okay, inside the body. So you see a lot of eggs inside there. So you palpate. You don't palpate so much, or else you crack the eggs. If you crack the eggs, another issue also. It can cause peritonitis. You call it egg peritonitis. Okay, so that's something that you do lah. So a lot of things. Based diagnostic procedure, further diagnostic test depends on your basic physical examinations. Okay, that's all for pet birds just now. Okay, for pet birds, like I told you earlier, it is very similar to cat and dogs. Okay, very similar to other pet animals. You do a thorough physical examination. However, it's different for poultry. For poultry, okay, we do take history taking. History taking is different based on the farms and whatnot. Instead of individual bird examination, you start off like flock examination. You have to look at the birds, okay, overall, examine the whole flocks. You enter the farm, examine the behavior of the animal in the flock, how they look like, why are they look sick, or what's the sound like, are they breathing normally, any sign of them showing clinical signs, are they most of them on the side of the farm or in the middle of the farm. So it really depends on the management also. There are a lot of things you can come. And then after you do a flock examination, you should have some sort of like general idea what's going on at the farm. And then next, you take some birds. Okay, you take some birds, some good ones, some with clinical signs, some dead ones. Okay, if you go to a farm like 10,000, 100,000, 1 million birds, there's always that dead chickens. So you just take some of the dead birds, take some good ones, some of the bad ones. Good ones just for to compare, and then you do necropsy. Okay, you euthanize all these birds, and then you do necropsy, because for poultry, necropsy is the number one sort of like number one diagnosis steps, diagnostic steps. Okay, before you proceed further with sampling and laboratory diagnosis. Okay, flock examination. Number one, general observation. Healthy birds usually they look active, alert with bright round and open eyes, bright red combs, their males. Okay, clean, smooth feathers and neat scaly legs. Feces are well formed, brown or grey with white caps, which is the urates. They stand, they walk, and they run. The moment you walk towards them, they should move away from you. They run away from you. Young broilers often found fighting if you go to broiler farms, or if you go to breeder farm also. You can see the male are fighting. Okay, birds found mating. Okay, that's normal. Eating and drinking, you can see them eating and drinking normally. Okay, however, in unhealthy birds, they look dull. Okay, stained feathers around necks, vans, shoulders, or eyes. They just literally look dull. I mean, the feather also look different, like ruffled feathers. It's not like smooth and shiny. There's some swelling, redness, or feather loss around the eyes. Sometimes discharges around eyes or nostrils if it's the respiratory issue. Neurological signs, you will see torticollis, paralysis. They just don't walk. They're walking also, the gait is wrong, the lameness, they show sign of lameness. Respiratory signs, there's some rales, cough or sneezing. Have you heard of chicken cough and sneeze before? I don't think you have heard before. The only way to do respiratory signs, examine respiratory signs, is for you if you go into the farm, you sit in the farm, look closely, let them settle down. Usually, the moment you enter, they got panic. They look at you and panic for a while. And then you just sit down, do nothing, and listen. And then after that, they don't care about you anymore. They don't care. Just listen. Don't move. And then you can hear some like cough or sneeze or something. Right? It's quite unique. They are very pale sound like that. They're sneaking. It's like they sneeze like that. Okay. So all these sounds you can observe. And then injury or bleeding in some birds. Okay, behavioral issue also. They should have eating, and they should be eating and mating all the times. And paleness or swelling lesions on the skin also. You can see this on sick birds. Okay, this is how chickens look like if they are healthy. Okay, if you go to chicken farm, look at the feather. The shiny, the eye is bright in color. They're looking at you. Even the comb and wattles are pink. Okay, they just move around. This is turkeys. Okay, and this is how the not so good look like. Okay, you can see the feather here, droopy wings. They are so weak, they cannot put their wing on the side already. They droop their wing. Okay, dead animals. Okay, in some of they're too weak, they cannot lift up their head anymore. And then some of them just lying down. Okay, seed flocks sometimes is you move towards them, they don't really run, they don't bother to run anymore. Just like, okay, they're really weak. Okay, and these some examples that you can see. Just ruffled feather, all these things. You can see the eyes here. You can see even see the third eyelid. It's like dead chickens, I think. Torticollis also. And then you see the uniformity issue. This is turkeys. You can see the punat there, a little thing there. These are wattles. After they grow up, they become wattle. Okay, and all these things. And then this is a chicken, male chicken. Okay, you can see the water here is so swollen. This is gaseous material inside here. Most likely this is fall cholera. Okay, and then this like all this chicken. You can see all the chicken, the small one. These are stunted bird. Okay, the feather are fully grown. Okay, the feather are fully grown, but their size is the size of a chick. So they are actually stunted. So these are stunted, and you can see the feather is like droopy wings. Okay, this fully grown. Okay, just show you a video. I don't think you can hear the sound, but it's okay. No need to hear lah. Okay, example of chicken with Newcastle disease. Okay, he's not dancing. Okay, that's a neurological sign. That, okay, the torticollis. Okay, I just visited a farm with Newcastle disease like 2 weeks ago with your senior, your rotation. Okay, that's how it look like. IB infection, infectious bronchitis. Okay, when a bird have when a poultry chicken have respiratory issue, you see the breathing pattern. When they breathe, they extend their necks. So means like they're having difficulty to breathe. They yeah, they have to extend their neck. Okay, the normal one usually okay. This one is when cannot even open the eyes. You can see the wing so droopy. Okay, the wing is droopy down. Okay, so that's how they look like. I have a lot more videos lah from my case. Yeah, this is how they look like. This chicken with streamers. Okay, and then you do postmortem lah. This one is okay. Okay, and then you check them individually. You take some birds while they are still alive. Okay, you do individual physical examination. It's similar that like I told you earlier lah. You check from up to down. You palpate literally everything and whatnot. And then okay, this is the things that you can find lah. Pendulous crop. Okay, clinical signs, cannibalism, end bites, all these things are rickets. Rickets means like the bone becomes softened, you cannot break it, okay, due to nutritional issue, okay. And then infectious laryngitis, they coughing about blood. When they cough out blood. And pox, they see all these crusty lesions on the skin, okay. Respiratory disease, the eyes become swollen. And then conjunctivitis, there's some discharges on the nose as well. Pendulous crop, the crop losing its elasticity. All the food they eat, they stored here. And then the food become like bussy here, okay? And then skeletal diseases, the shank become too thick. Respiratory disease, this is mycoplasma. If I cut open this one, there's a lot of caseous material will come out, the abscess. Okay, pododermatitis, you look at on the pad, you'll see like pododermatitis. Okay, these are the things that you will see lah. So if don't worry about all these diseases because you are not supposed to know about diseases yet. I will teach you in avian medicine later on, but it's more on general physical examination. Okay, and then next one is do necropsy after that. Okay, necropsy also I will teach you during your rotation actually. Okay, stop sharing. Oh, 1 o'clock already. It's hungry time. How did you explain to the owner in that case? In that case of the bird died, is it? Okay, just tell them, sorry, it happens. Shit happens. No, usually it always happens, okay? They if the owner but bird breeders or something, they are quite aware of this thing. It happens. Okay, they are quite familiar with these things. The bird died in front of you in cages or something. I'm sorry. Usually birds are like this one. They have they can have heart attack because sometimes they just panic, heart attack, and then drop dead like that on the back. Actually, birds are quite prone to heart attack also. Not just humans. They're prone to heart attack also because they pump heart really fast one. Okay, the heartbeat is like really fast. So that's why sometimes we don't even bother to measure the heartbeats of birds also. Okay. So just have they will understand lah. Sorry. Usually these kind of things happen due to when the birds too panic. Okay, when there's too many people or something. Okay, sometimes you can do lah. You cannot comfort them so much lah. Okay, sometimes they already bring birds that almost dead. You know that the bird will die in few days. It's like when the bird are like really recumbent, the prognosis like also like quite bad already, because when they are recumbent, they actually what do you call it? When they are recumbent, their breathing also will become very bad because they need to expand their air sacs to breathe, right? Okay, so when they become recumbent, so the prognosis become bad already lah. Do they still pay for the service if you do anything lah? If you haven't even touched the animal, then they don't have to pay anything lah. But they probably have to pay because here the moment they have to pay consultation like 20 ringgit I think or 30 ringgit, that's all. If we do any tests and then they die, then they have to pay all the tests lah. Okay, it happens. So we still have like budi bicara there. Okay. Any other question? What happened to Ayam Cafe K17? Hey, K17 have a new cafe, new management, new tender, I think, new cafe management. You should have a good foods now. No? Okay, just bear with it lah. If not, order lah. You kaya-kaya semua. I saw all of you buy handphone lah, apa lah, new PC lah, gaming PC and whatnot. Okay, any other question related to the topic to physical examination? I'm not sure when is my Boyat new PC. Itu Nokman kan beli new PC, gaming PC. Saya ke office pun pakai gaming PC. Tapi yang dulunya. Sebab dulu saya punya PC rosak lah. Bukan, dia UPM bagi PC tapi you know lah, PC yang RAM pun 4GB je. And then graphic card pun tak ada. So, susah nak buat kerja lah. Cik, alasan. Okay. Any other question? So, I'm not sure when is your practical class, but I'll see you there. And then we'll go in details on how to do physical examination lah. For today, it's just for, call it, introduction only. If I'm not mistaken, you have test 1 today, right? Kan? Bukan ada test 1 ke hari ni patutnya? Dr. Haya beritahu ada test 1 hari ni. Korang patutnya. Petang ni Okay, good luck lah. Sepatutnya saya punya ni, yang Avian ni pun masuk test 1 tapi saya refuse lah sebab tak ajar lagi. So saya kata saya punya saya masuk semua dalam test 2 lah. Even yang saya punya hari tu rasanya. Yang biosafety tu. So mungkin tak masuk test 1 tu. Masuk test 2. Okay, any other question? Good luck on your test today. Okay, if there's none, go have your lunch and get ready for your test. Okay, see you guys.
Thank you, Doctor.
Thank you, Doctor.
Thank you.
Doctor.
See you soon.
Thank you, Doctor.
Thank you.
Thank you, Doctor.